Welcome to this advanced masterclass on the JESU5C Diagnostic and Pattern Classification Protocol. Today, we'll walk through exactly how to establish the Hyun-Ga Axis through X-ray reading and how that translates into a precise clinical application of HGMT. This session is designed specifically for practicing Korean medicine doctors who want to apply this protocol directly in clinical practice. Let's get started with a real case. Every reading begins the same way, with a careful anatomical review. First, we run through the general ABCDES, A for appliances and airway, B for bones, C for cardiac, D for diaphragm, and E for everything else. Only after that do we look for anatomical structural issues. In this particular X-ray film, notice the right-sided sacralization, circled here in yellow, and the left 12th rib, which is visibly shorter than the right. We also rule out numerical anomalies in the cervical, thoracic, and lumbar spine, the presence of cervical ribs, and semivertebrae, and confirm the overall alignment before moving forward. Next, we assess global balance by drawing two boxes, one around the body cavity, and one around the pelvic cavity. Here, the body cavity box, our upper body reference, appears shifted to the left relative to the lower body. The pelvic cavity box, in turn, is shifted to the right relative to the body cavity box. Clinically, this tells us the upper body is macroscopically imbalanced toward the left, relative to the pelvis. And here's a key diagnostic clue: in the J pattern specifically, the pelvic cavity box characteristically deviates away from the body cavity box, exactly the kind of divergence we're seeing here. Now we draw line 1 of the Hyun-Ga axis, a line connecting the posterior spine. At this stage, don't worry about precision, the goal is simply to capture the overall direction of the deformity with a rough line. In this X-ray film, we can see subtle directional changes starting in the cervical region. But the real shift begins at the TLJ, the thoracolumbar junction. That's where the main deviation starts in earnest. Then a second major change in direction occurs lower down, around BL23, Sinsu. These directional inflection points are exactly what we're looking for. With line 1 drawn, we now locate the subluxation acupuncture points, specifically, the mechanical transport points where the line's direction changes. In this case, those inflection points fall around BL20, Pishu, and BL23, Sinsu. This step matters because it takes us beyond a purely structural diagnosis. It's the decisive criterion for identifying which meridians, and which manual treatment points, are clinically relevant. This is a core focus we cover in greater depth in the intermediate HGMT course. Now we're ready to determine the JESU5C pattern, based on the overall shape of line 1. Looking at this X-ray film, the shape resembles a mirror image of the number 5, so we classify this as a Re5 pattern. But I want to highlight something important here. This case presents as postural scoliosis, not idiopathic scoliosis. And it isn't a single, fixed pattern. The balance between the upper and lower body is actually shifting, from a Re-J pattern toward a Re5 pattern. This kind of composite, transitional presentation is common in real clinical practice, and it demands careful, deliberate differentiation, not a snap judgment. Finally, based on the Re5 pattern we've identified, we decide on HGMT number 4, combined with acupuncture technique. The biomechanical force matrix breaks down into 3 directions. First, we apply traction to the lumbar spine, following the direction of the arrow shown here. Second, we push the left lower extremity inward, in the direction of internal rotation of the left hip joint. Third, we push the right knee outward, in the direction of external rotation of the right hip joint. And that completes the full protocol, from X-ray reading, to establishing the Hyun-Ga axis, to a precise, biomechanically grounded manual therapy, a seamless diagnosis to treatment pathway.